Okay, I'm delighted to introduce the next and our last panel of the day. Dr. April Zeoli is an associate professor of criminology at Michigan State University, and she told me that somebody, I hope you don't mind me telling you the story, it's not bad. Don't worry. I'm not. Yeah, right. Yeah, I'm not always inappropriate. No, but she actually was trained in public health at Johns Hopkins University, but she's in a criminology department, and so she is a public health criminologist, which is sort of interesting. And your mentor's on this board. That makes you really nervous, doesn't it? Always did me. Oh, it always did me whenever my mentor was in the room. Anyway, this is our last session, examination of policy, understanding current policies in child and adolescent outcomes, and I welcome April.
We're doing okay? Okay, doesn't have to go first. Okay, how do I get to my slides? So good afternoon. Thanks for hanging with us all day, and thanks again to our leaders of facts for getting us together, and to our funders. Though did Valerie leave? Well, she left, but thank you to her. Could be online. There you go. So I'm going to lead off our panel on understanding current firearm policies and child and adolescent outcomes. We're also going to hear from Dr. Charles Branas, Dr. Daniel Webster, Dr. Kanzoni Asabigi, and Ms. Adelyn Allchin, who I'll introduce in turn when we get there. It's important to recognize that laws, federal laws, state laws, have the potential to impact firearm injuries among children and teens. They have the impact to have these large ecological effects. But we haven't been studying the impacts of state or federal laws on child firearm outcomes. In fact, the Giffords Law Center reports that roughly every year there are about 1,700 firearm-related bills in front of state legislatures across the country. And we don't have nearly enough research to address the scope of what those bills are presenting. You've heard about the scoping reviews the facts teams have done. My team looked at a scoping review. We did a scoping review on firearm policies and their association with firearm outcomes among children and teens. And though our window was large, 1985 to 2018, we only found 20 studies that even kind of looked at these questions. Most of that research was around child access prevention laws, and some were around minimum age restrictions, and those make sense because those are targeted towards children. Some of them looked at purchase-related laws, junk gun bans, and then many of them looked at this, kind of composite score of the strength of firearm laws in a state, the permissive or restrictive states that you're going to hear about later. The only real conclusions that we could draw from these research studies was that child access prevention laws were associated with reduced childhood unintentional and firearm suicide deaths. But the research was really too sparse and sometimes really not rigorous enough. There were quite a few cross-sectional studies to measure the impact. So there's a lot of ground for us to cover, and if you are, thinking about going into firearm violence research, policy is a great place to be. And Daniel Webster is going to talk more about that. But what I wanted to know was about extreme risk protection orders. Some of you know what extreme risk protection orders are, but I hear that some of you don't. Extreme risk protection orders are civil orders. They're not part of the criminal justice system that some states, about 17 states in the District of Columbia, have, where law enforcement or a family member can go in and say, this person is at risk for suicide or for committing harm against others. And a judge will evaluate that evidence and decide whether or not that person needs some kind of immediate intervention by way of removing deadly weapons or preventing them from purchasing deadly weapons for some period of time. After that period of time, they would regain their right to have and purchase firearms again. So we wanted to look at Oregon. And in Oregon, law enforcement, family, household members, and intimate partners can apply for these civil court orders to temporarily prohibit firearm purchase and possession by someone who is at high risk of harming themselves or others. And we specifically wanted to know if they were being used to respond to safety risks to children, teens, or schools. Now, these ERPO laws proliferated across the country after the school shooting in Parkland, Florida. And one of the reasons they did so was because the shooter had exhibited signs that he was high risk for committing violence and committing violence against the students at that school. And people had told law enforcement that this person was at high risk for committing violence. But there was no mechanism under Florida law at the time for them to remove guns, for them to, make this person temporarily unable to have guns. And so they didn't. But now Florida has an ERPO. We're going to talk about Oregon's instead. We collected all of the ERPO petitions in Oregon from January 1st, 2018, which is the first day ERPOs were a possibility in Oregon, through March 31st, 2019. And we had an intrepid and dedicated research assistants who double-coded each petition, and shout out to my research assistants who are in the room. They read all of these petitions, and some of them were not fun reading. We found that 81% of the respondents to the ERPOs, so the people who were getting put under the ERPOs, were male, as we would expect. About 74% were reported to already possess a gun, which means that about 26% of these ERPOs were not about removing guns so much as they were about preventing later gun purchase. 56% of the petitioners stated that the respondent had unlawfully or recklessly used a deadly weapon. While the question does ask about a deadly weapon and not specifically a gun, the narrative information provided suggested that many, if not most, of the deadly weapons they were misusing were, in fact, guns. 73% had a history of suicide threats or attempts, and 74% had a history of threats or use of violence against others. There was obviously large overlap between those groups. I think it was about 53% or 52% had both suicide threats or attempts and uses or threats of violence against others. Quite a few of them had reports of unlawful drug use, 36% of them. And then 54% were reported to have a mental illness or mental health issues. And I just want to touch on this in particular for a moment, because these ERPO petitions are filled out by law enforcement and family members. They're not filled out by psychiatrists or psychologists or people who have made those diagnoses. And so some of the information on these is to the best of the petitioner's knowledge. And so we'd have some petitions where you would get a very specific diagnosis. This person is a military veteran and they have post-traumatic stress disorder, for example. But we'd also get, petitions that said this person seems like they have depression, but they won't go for medical treatment, mental health treatment. So the information there seems a little fuzzier. And the ERPOs were granted in 83% of cases. 22% of the extreme risk protection orders documented some kind of safety risk for children or teens. Now, we define safety risk to children or teens as a very specific child or teen being named in the ERPO as being at risk, as in these examples. The respondent threatened that in addition to killing himself, he would kill his 3-year-old son and anyone else not willing to help him pay the $300 he owed in child support. The respondent had put his gun in his daughter's hand and told her to shoot him. And the respondent pulled out his gun and told the petitioner's stepson that he was going to shoot him. Most of these were really about the respondents' children or stepchildren and threats to them. Now, 33% of the petitions documenting these safety risks to children and teens were denied. And reasons included that the petitioner did not present clear and convincing evidence of immediate harm, and that is in fact a box that the judge checks. So we don't know any more than that about why the judge did not find clear and convincing evidence. Interestingly, some of them, I think only one of these, was denied because the respondent was already legally prohibited from having guns. So we don't know what happened in that case. You know, was this case shunted to the criminal justice system because there was illegal gun possession? Or did it just stop there? You know, was it the petitioner's responsibility to go to the criminal justice system and report that? I don't know, and I don't know what happened. But a follow-up study will hopefully help us find out. And finally, one was denied because the petitioner didn't show up to the hearing. So the petitioner has to be at the hearing for the ERPO to be granted. The respondent does not have to be at the hearing. If the respondent does not show up, the hearing can move forward regardless. So that was 21 ERPOs looked at the safety risks or mentioned safety risks for children and teens. We had 6 that mentioned safety risks to schools, and only one of these cases overlapped. And these were what you would expect them to be. The respondent threatened to commit a school shooting and then commit suicide. The respondent spoke openly about planning a school shooting. The respondent made threats to a school, causing it to go on lockdown. We had one where the respondent was found drunk with a gun on campus, threatening to kill people. So these ERPOs are being used to hopefully counter potential school shootings. All of these ERPOs that had documented risks of safety to schools were granted. We hope to do in the future an individual level study really looking at the petitioners and, the respondents of ERPOs and how they move forward through time, what safety risks they continue to have and what the outcomes might be to really get at the impact. This is just a description of the ERPOs, but we want to obviously go further than that and look at the outcomes of the ERPOs. So hopefully that will be in the future. Right now, I'm going to turn it over to, I think we've changed the order a little bit, to Dr. Kanzoni Asabigi, who is the Senior Public Health Advisor to the Detroit Health Department. And he's going to talk to us about violence prevention in Detroit.
Oh, okay. Good afternoon. Thank you for inviting me here. I don't have a PowerPoint, but I have a nice picture here for you to see, Detroit. Maybe some of you think and move back to the city of Detroit and stay over there. But I want to thank and give a shout out to the Injury Center here for working with us in the city. Jason, Amanda, Zaire, and Dr. Cunningham. Working with us on opioid overdose prevention and fatalities. We still, they've done a lot of providing data to us and refining the data. We still have a problem in the city in that our overdoses and fatalities continue to go up, but in the county and statewide, the numbers are coming down. So we need to figure out what's going on specifically in the city of Detroit. I also want to thank my colleagues for allowing me to, come forward before some of them. And although the police department is not here, I really want to thank them for sharing data with me. They are a tough cookie. They don't want to share any information. But we do have to work with them if we want to do something about violence prevention. So before I talk about that, I just want to give you a brief overview about the city of Detroit. The population is currently, as of this year, 673,000. down from a peak of 1.8 million in the 1950s. 80% black, that's also down from about 85, and whites make up 14%, that's high by about 4 to 5%, and Hispanic population is 8%, and Asian population 2%. The majority of individuals in the city are female, so they get to tell us what to do, including my wife. But the poverty rate in the city of Detroit is 39.7. That's huge. And that plays a role in gun violence. And the city is really huge, 143 square miles. That's huge. So you see there's downtown, but if you go in the neighborhoods, it's a little bit different than what you're seeing here. So I just want to, again, thanking the police department, I want to just give you a little bit of some stats for the last 3 years, 2017, 18, and through June of this year, and just focusing on individuals who are 19 and under, from 0 to 19. We do get, the news media, talking about, violence when it comes with the use of guns from, kids. We recently had a 2-year-old who was gunned down on this highways. So for these 2.5 years, for non-fatal gun shootings, we had 273. That's a lot. 85% male, 50% female, 93% blacks. Those under 16 made up 22%, and 16 through 19, 78%. Now the motive for shooting, argument, 25%. Robbery, including attempted robbery, 9%, self-inflicted 10%, and other 56%. So the other 56%, we need to know more about that. And that's where public health needs to come in to really provide expertise and working with the police. Occurrence, we have 60% on the streets, 28% in residence or in front of the homes, and 12% in the park or business or other locations. And, in the city, we see the shootings in 2 areas by police precincts. The 8th on Northwest, and then the 9th Northeast. Just, and they both border, rich neighborhoods, Grosse Pointe and Redford on the other side. The other thing we've noticed also is that most shootings occur in June, July, and August. June, July, and August. So that's something for us to really take into consideration as far as policies. For fatal gun violence, we had a total for those 2.5 years, 38, and 92% African American. Those who were 16 and over, that was 89%. So we do see that 16, 17, 18, 19, and 18-year-olds are the most at risk for fatal shootings. Again, here occurrences, 58% on the street, 34% in residence, and the others other. And the motives here, again, we see arguments. So arguments is something that we really need to look at and try to understand why people use a gun if they argue. There's absolutely no need. If you argue, you argue. So don't use a gun. Use your fist or do something, right? I'm not advocating for it. At least you'll survive if you fight, right? But if you use a gun, Harm reduction. That's right, harm reduction. So the toll of guns in the city of Detroit, we have the individual consequences, injuries, and disabilities. So I've seen quite a few young folks in wheelchairs, and this is for life. We have family, emotional and traumatic consequences, economic burden on these families. Again, these are kids that come from poor families. Societal issues. So there's a lot of fear in the city of Detroit because of gun use. Safety issues. People are arming themselves. They're locking themselves in their homes and just, trying to use every means to protect themselves. And most of these teens are on Medicaid. A significant number of individuals in the city of Detroit are on Medicaid, so we're all paying for it. But when we come to public health, it's important that we play an increasing role in here because there's an increase in the number of premature deaths. People are dying much younger. The physical and mental health consequences, increase in utilization of health services, especially in emergency rooms, we see that. And the two hospitals, Sinai Grace and Detroit Receiving, are the most areas that people go to. And the economic burden, I cannot overemphasize this. Sometimes we have to sign off at the health department death certificates when people don't come for the bodies. And quite a few people cannot afford to bury these kids, and it's a really big problem. And we have, bodies in the medical examiner's office that haven't been claimed. And, this also leaves families spiraling down in poverty, and the circle just continues to repeat itself. So with this, I can just give you some gaps in the data that we have, and this is something that I'm going to plug into the injury center. We are reconstituting for them to assist us here. We don't have any information about the perpetrators. Who did that? The police may know, but they may not be sharing information with us, and we really don't understand the root causes of some of these issues, especially when it comes to arguing. Limited data on the victims, no family history collected on the victims. Most often from literature, somebody in the family has also had similar issues. No information about the guns, whether they are legal or illegal. No information about gun safety education. And this is where sometimes, we encourage the police that when they're doing gun safety training, they should allow anybody at all to come in there. We do have a lot of people who, haven't purchased their guns legally, but I think that they need to know how to learn about safety measures and how to protect kids from getting to this. Using the guns. Inconsistency in how data is gathered, so we're from law enforcement. This is where we need to work with law enforcement to make sure that we're getting the necessary information on that. So I'll just take a brief, maybe 1 minute, 2 minutes left. Okay. So the mayor has initiated what he calls ceasefire, and he adopted that from, and with some modification from Boston, and targeting young males who have committed a crime using guns and have outstanding warrants. So they're targeted, they're given a notice to come to a meeting, a community setting, and there's law enforcement there. And, I had to insert myself in there from public health, and they are given a choice. You either come with us into this program, we'll help you get a job training, and in some cases expand your record or not get it to the trial. Some do, some don't. It's almost 2 years now. And as I was listening to some of these issues, why people did what they did, I heard one guy say, "Oh, I had to steal to get diapers for my kid." Diapers, or buy milk, or a car seat. Now, this is something that the health department provides through the Children's Specialty Healthcare Services. So I offer that, and we have WIC services. You don't have to steal to do these things, and also use a gun. So in conclusion, our recommendation, public health should lead a lot of these initiatives. We just got through bankruptcy, so we are reconstituted at the city of Detroit. But this effort is being led by law enforcement. They are part of it, but I don't think that they have all the tools because the community don't trust the police and will now open up to discuss issues with law enforcement. And that's just a given, not to say that, nothing wrong with that. Policy changes, we advocated for changing policies in the school system whereby kids are not suspended if they get into trouble, just arguing. So the Detroit Public School used to, send these kids home. There's nobody home, they have a lot of time, they get into trouble, and they use drugs. In the city of Detroit, the average age at which people use drugs is age 13, regardless of the substance. So that's something that we need to work on. So we also need to look at, working closely with law enforcement, have also Injury Center help us, changes in policy in regards to behavioral health, that's mental health and substance use disorder. I advocate for screening from K to 12. We have to get rid of the stigma and get people help. We really know the kids that have mental health disorders, and what we do is label them as bad kids or kids with trouble instead of getting them the help. Funding is a big issue, so we need to lobby to make sure that there's funding for youth and have those kids get jobs during the summer. So thank you very much, and thank you.
And now we'll hear from Dr. Charles Branas, who is the Gelman Endowed Professor and Chair of the Department of Epidemiology at the Mailman School of Public Health at the University of Columbia University. Almost got through the whole thing.
Officially Columbia University in the city of New York. For those who don't, I had to learn that myself. So, okay. Thank you very much. And I'm going to just start by saying thank you to the local team here at the University of Michigan. What a tremendous day we've had, a couple of days we've had. Really looking forward to this again next year, and what a variety of people we have today, ranging from prosecutors in the justice system on to public health officials, on into the medical system and so forth. So it's just phenomenal. I want to talk to you about some of the work we've been doing with the FACTS team here. I'll conclude with their names, but and I titled this Evolving Solutions to School Violence and Shootings because the solutions are still emerging, right? So we're trying to just figure it out, and we're evolving them, right? So we're trying to produce something here all at the same time. And I want to start because I think much of our work has been focusing, I'll show you some examples, on mass shootings, particularly mass shootings in schools. And I think it's important to say, and a few of the other speakers have touched on this, that mass shootings are really the tragic tip of a much larger iceberg of shootings in the U.S. And when you pull this down, you pick out all shootings, whether they're fatal or not, right? Those who pass away and those who survive. It's really the tiny top of it. And these other sorts of shootings, these what I would call day-to-day shooting events, are really dominating this pyramid and this iceberg. So I think we need to put that out there. I am going to talk a little bit about mass shootings in schools, but I want to broaden that conversation to think about shootings in schools and perhaps even more broadly violence in schools. So this is work that Paul Reaping and a number of other people, Paul led this, Paul who's a doctoral student at Columbia over there and won the award, lovely. for his poster, which I'll refer to in a second as well. We did this work that was published earlier this year on the difference between states that are very permissive on average in terms of their gun laws and those that are restrictive. And what you find is that on average, states that are more permissive with their gun laws have higher mass shooting rates than states that are more restrictive. And which is interesting, right? It's very important in and of itself. But I think what's perhaps disturbing about this is that the differential between those sorts of states is changing and getting broader. The difference between them is in recent years between permissive states, which seem to be going up, and restrictive states, which seem to be going down. Now, we did this work by using a couple of different metrics. And I want to make sure, Lynn, that you have do we have the right one here? That I have up? Yes, it is. So we used a couple of metrics. One was this traveler's guide, which is created by lawyers in the state of Kentucky, a legal firm. And this is a guide that allows you, if you're a gun owner, to know which state, if you want to travel between states, where you can take your gun and what are the rules in the neighboring state or perhaps the state you're going to traverse. We use this for a couple reasons. One, we didn't want to get told that we were using something that was produced by a different set of eyes. So this is produced by gun owners for gun owners. So we thought that was a good metric. And by the way, it corresponds very highly in terms of the restrictiveness or permissiveness with every other, I should say, metric out there that measures permissiveness and restrictiveness. And we also looked at not just restrictiveness and permissiveness in states, but we also took a look at gun ownership. And to do this, we used a common metric, which is the percentage of suicides that are committed with firearms in each state. It's a common metric and a reasonably well accepted and accurate metric of gun ownership per state. We then took it as opposed to all we started with mass shootings broadly speaking, and then we began to think about this relationship between gun laws, gun ownership, and school shootings. And we defined school shootings a number of different ways. One was any gunfire at a K-12 school, and then we also looked at active school shootings, which were defined as a gun discharge on school property while the school was in session, in which 4 or more people were in the line of fire. And it's interesting to take a look at, and I'll get to it in a second because I think there's a lot of limitations to what we're looking at here. Sometimes the blue line is higher than the red line for certain years, and sometimes the red line is higher than the blue line, and it's unclear. And so we did pull together 5 national databases looking at this, ranging from what was at the Washington Post to the Naval Postgraduate School Shooting Database to the FBI archive and on down, and even pulled some data from appendices to pull this together. And we think it's a reasonably complete list, but it's unclear because we have no common database of this in the United States to begin to look at these issues. And not only no common database, but no common definition of what this is and what we're going to be calling a school shooting. I'm not going to dwell on the results. I would encourage you to go see the poster, again, that Paul Reaping is leading, and it was out here in the hallway. And if you read it, what you will see is that, again, there's a strong correlation, especially after adjusting for various factors of poverty, unemployment, and other factors at the state level, between restrictiveness, permissiveness of gun laws, gun ownership, and the occurrence of school shootings, K-12 school shootings in states across the U.S. So without dwelling on that, I'll say that our work ahead, we have a number of different things. And I mentioned this yesterday to the smaller group, but I want to re-air it here. And the first is that this list of databases on school shootings, someone needs to get down into the weeds and really reconcile all of these different streams of data for their accuracy and for consistency of what's being said. And then to get all the way deep down into the weeds to get the details about these events, which are often passed over. Perhaps an event occurred, but we don't know the circumstances or the tiny details of that event, and it would be very helpful. The next step is it's important to know that there's a difference perhaps in general between restrictive states and permissive states, but that's not guidance for policymakers. Policymakers aren't seeking to make their state either restrictive or permissive. They're seeking to pass different laws to prevent these events from happening. And so we need to begin to test these laws very specifically. And a number of people on the panel here are doing that and have done that, of course. To April's point about cap laws, and April's part of our group, cap laws are an interesting and important opportunity here, these child access prevention laws, but they come in so many different flavors across the states, and no one has really sat down to, again, dig into detail about the child access prevention laws and what should we be pulling there. And then the last thing I want to talk about is I think we then need to go further at the school level, not the state level, and to begin to look at really directly trying to start evaluating the tactics, the policies, and other modifiable factors in the school and in proximity to schools that might either be associated with these acts of school violence and shootings and mass shootings, or things that could actually be changed to prevent these from happening in the future. And I hearken back to the superintendent's talk this morning, which was so moving, and try to answer some of his questions. Sonali Rajan, who's also in the audience right there from Teachers College, Columbia Teachers College, and I wrote this in the American Journal of Public Health recently, last year. And it's interesting because we wrote this in response to noticing that a number of school jurisdictions were just arming their teachers as a matter of policy, and either as a matter of policy or just encouraging their teachers without policy to arm themselves and to bring their weapons into school. Now, I'm not passing judgment on what the answer to that is. I mean, in theory, a part of our line was this. How many of you, I mean, I have little ones, and I will tell you that my father, as a career educator, was an elementary school principal and a 6th grade teacher. And I never realized what he did for a living until I had kids and went to volunteer in their classroom. And by the way, it is a zoo. And I don't think that's the Philadelphia public school system only. So, you know, if you're volunteering in a 1st or 2nd grade classroom, there's a lot going on. And especially if you're the only teacher and there's 33 kids in that class and they've taken the assistants out of that class for you, right? You need the parents there. But I then want you to think, you're now asking that teacher to manage that classroom and then to be trained with a weapon and to be capable of distinguishing a real threat from a not real threat and to secure that weapon and so forth. So asking our teachers in these very difficult environments, A, to do their job, and then to do someone else's job on top of that, to do double duty as a teacher and a law enforcement officer is very challenging. That is my hypothesis. But I think this is all testable, and I think there's a list of tactics. And I'm going to add to it what the superintendent said this morning about simply putting inside locks on school classrooms. I mean, these sorts of little things. So we have a list of them here, ranging from metal detectors to bullying suppression on to arming teachers. And there are ways that we can begin to study these and the implications that these have in terms of their success. So we did this study years ago it was a case control study. This is where you find individuals who have a disease. In this case, our cases were adolescents who had died of homicide. The vast majority, this is in the city of Philadelphia, the vast majority of these adolescents had died from gun homicide. And we found there was 143 of those adolescent homicide cases, and found randomly selected 155 matched adolescent controls that had not died of homicide. And we wanted to look at what was in the environment around them. So the two pictures you see are two different environments that were photographed at the site of either the cases or the controls. They all got photographs. And we not only took these singular photographs to see what the children were experiencing or seeing at the time, but we took, you can see that here's a single photograph blown up, we took a full 360 of their experience and what they were seeing. And everything in that environment got coded, what was around them, at the time. And so I have to credit, this is two papers, one by Allchin Silva, who's in the audience, and another by Bernadette Hull, who's in the audience. These both appeared in JAMA, and we were able to take a look at and put some odds ratios. That is, if this is above 1, you see the numbers outside of the parentheses. If it's above 1, it means that it's generating a risk. If it's below 1, it means it's protective against whatever you're seeing. And so we were able to say for a number of different things, how did they relate? How did they associate not only how did they associate, but perhaps in the future we might change these things to prevent the adolescent homicide, and you could see the differences that some of these generated, including some of them were quite statistically significant in terms of the implications they had for adolescent homicide. So we think we can do the same thing with schools. That is, finding schools that have experienced shootings. We'll find what definition that may be, and I think that's debatable. Finding a random selection of schools around the nation that have not experienced shootings, and then finding out what they were exposed to in epidemiologic language, but in this case, exposure is these different tactics. Again, ranging from metal detectors on down to arming teachers. Right? So, and I took this from Leon Gordis' textbook for anyone from Hopkins, just so you know, I'm shamelessly using this. I use this for class. But anyways, and this is bread and butter epidemiology, this case control method, and it is a perfectly valid method to use to begin to answer questions like this. Okay, so I think we're on the verge of perhaps doing something like this. I also want to put out there two other ideas. So the case control method is the first step. I do think we can also start thinking about actual experimentation. This was work we did years ago at the University of Pennsylvania using a shooting simulator where different firearms were brought in. These are not real guns. These are real guns, but they have been retrofitted to fire laser bullets. People are basically put in video scenarios. This was all adults. But it allows us to begin thinking. A number of these scenarios, by the way, are for officers training on how to defuse a school event if there's an active shooter in a school. It's very challenging, and it would be fascinating to begin to study these in a laboratory setting to see what might work and what might not for people who do have firearms in these settings. And the last thing I'll say is extending that, not only laboratory trials and experimentation, but I think it's important to go out into the community and make changes that could affect the health of kids, perhaps the safety of children. This is work we're doing in New Orleans right now, changing vacant lots, where a certain number of lots are assigned to be changed from what you see on the top to what you see on the bottom, cleaned and greened. Is this akin to the work that was presented this morning that came out of Flint? But again, this is true experimentation, and there's real opportunities here to do what I call win-win science. And that is that we can generate new knowledge, test whether these things work, but at the same time bring resources and perhaps federal monies to under-resourced neighborhoods that are most in need. And that's all I got. Thank you very much.
And now we'll hear from Dr. Daniel Webster, who is the Bloomberg Professor of American Health and the Director of the Center for Gun Policy and Research at the Johns Hopkins Bloomberg School of Public Health.
You got it. Yeah. Thank you. Thanks. Hi, it's great to be with you. What a great day. I am going to take 10 minutes, and no more than 10 minutes, to highlight a little bit about what we know about gun laws and risks for teens and children, mostly from fatal outcomes, but really spend most of the time focusing on, in essence, how can we get better? I don't think anybody probably in this room or is anyone who's looked at the available data is satisfied that we've figured all of this out. So I hope that in a span of 10 minutes I can at least provide a few helpful directions or comments for that line. Okay. So I'm going to start with the basic measurement of the independent variable. There's a lot of issues, there are a lot of challenges connected with this. I'll start with many studies have used various forms of strictness of gun laws. Charlie's team as well. While I'm from Kentucky and like Kentuckians, I'm not sure that I trust Kentucky defense attorneys to tell me about the restrictiveness of gun laws. And the same for, respected colleagues at gun violence prevention organizations like Brady or Everytown or Giffords. I think we really have to unpack the specifics of the laws and be very, very thoughtful about the mechanisms by which we think these set of laws will apply to the population of interest. In this case, we're focused on, again, on children and teens. So there's a conceptual issue there that I want to raise, but also just this, really trying to understand what a unit plus or minus on these are is not really interpretable. And where we want to get to, as Charlie acknowledged, of course, is we want to inform policy. How do we have better policies? Something I wanted to mention that's not on the slide gets to some of the weeds of some of the most important gun laws that we study. And an important thing to understand is that in many states, handguns are regulated differently, including in federal law, differently than long guns. Yet when you look at the guns that are actually used, particularly in homicides, roughly 90% are handguns. So there are some studies that have, in my opinion, erred by only looking at policies that cover all firearms and neglect the important set of measures, whether they be with comprehensive background check requirements or permitting requirements that only apply to handguns. So there have been some recent studies in the literature that, frankly, I think have gotten that wrong, and we're not learning what we need to learn from those studies. Charlie also acknowledged a thing that I want to spend a minute talking about is within each of these categories of laws, and Charlie mentioned CAP laws, child access prevention laws, enormous amount of variability. Principally, the thing that's been studied about the variability that we've done in some of our work, April's been a collaborator on one of those studies, is whether you can be prosecuted even with a felony prosecution for violating a CAP law or not. And some studies have shown indeed that does matter. But there's a lot of other important ways in which these laws vary, and we really should get down into the weeds and pin that down. There are helpful tools now. RAND has a database that's publicly available to study gun laws. And even that may not take you as far as you want. You might have to do a little legal research. April learned to do that as a doctoral student. It's not that daunting if you have a mentor. Not myself. In her case, it was John Vernick. So I want to, just as a point to make about the difference of licensing laws. Our team and Cass Grafasi has led much of this work, understanding the role of purchaser licensing laws, and boy, these vary in really important ways. And in some recent data, we look at whether there's discretionary issuance or not, and that's where the big effects we see are, but only a handful of states have those. And then you can have very weak laws where, frankly, you can mail in an application or online, and we're not seeing effects of those. So I'm raising these in part to sort of think about measurement, but also think about mechanism. When you think about what kind of gun laws might really impact youth risky access that would lead to fatal outcomes. And I guess where I'm pushing us towards, or where I'm at anyway, is to really think about exposure, right? I believe that purchasing permit requirements, particularly when there's discretionary processes allowed, a lot fewer people own guns, particularly handguns. And they're going to be less in the environment. I forget, I think it was Greg mentioned that George Tita's work finding a lot of underage youth get guns through theft, and we found that in some of our own studies as well. So if there's fewer guns around to steal, there are fewer youth are going to get them. So really focus on exposure and whether there's a probable mechanism by which these laws are going to do the trick. A little more on that. So what April and her team found in their scoping, excellent scoping article, of course, is one of the big distinctions in the different studies that have been published is whether they're cross-sectional, just look at cross-sectional variation versus an actual connection between policy change and change in mortality outcomes. And you can get very misleading findings from cross-sectional data because the probability that the laws get passed are driven by gun ownership rates, which also can influence the outcomes of study. And the reverse is true. Certain laws get passed because gun violence rates are high or rise. There's a lot of endogeneity issues when you look at cross-sectional analyses in particular. We are a little bit stuck when it comes to cap laws. There was a poster in our afternoon session that showed when the different cap laws went into play. Virtually all of them went into effect in the early 90s, and I think there's only one state that has adopted a cap law in the last decade. So almost all of our temporal variation of all the studies covered in April's nice review really focus on this little change in this one period of time in the United States. And you know, when you study policy, you're at the mercy of what are lawmakers actually doing, right? So longitudinal data, of course, is going to give our best estimates. There are different research designs and analytic tools that do that. Very common is panel regression analysis. Let's look at all the data that we have. We have 50 states. We're studying we're studying state laws. Let's look at these analyses. But of course, our states vary very dramatic in very dramatic ways, and probably have a lot of unmeasured confounders. So a lot of us are moving in a direction of propensity scores, synthetic control, various techniques that basically enable us to pair the closest comparisons of states that adopt a particular type of law versus a state that does not. There's a beautiful poster done by the group from Penn looking at stand your ground laws using synthetic controls. Very nicely done. And then finally, relevant to this, trying to, you know, it's kind of fundamental to any intervention study. If the treatment group looks very different from the untreated group, we're going to not feel comfortable that at the end of the day that we're truly getting treatment effects. So there are methods to weight your data so that you get the most comparable methods. This is just sort of a graph of synthetic controls that we did in one of our studies looking at Connecticut's permit to purchase law. And one nice thing about this type of approach is that you can also see how well your model is doing prior to the law in predicting the trends. And you also see the timing of any separation of what the counterfactual is had the law not been adopted and what was observed. And here you see a fairly immediate effect on suicide. And there I think it's very plausible because it's harder in that initial purchase to get a gun. But what we know about gun access and homicide is that many of the guns are quite old before they're actually used in a homicide. And it's very understandable that you're going to have a lagged effect. The minute a law goes into effect, there's already a lot of guns circulating in an underground market, and it's going to take a few years. There are things you can learn when you get down to the specifics of these. The last thing I want to really focus on here is, and it speaks to the lack of funding, honestly, in this area, is virtually all of this, we're using available data and we're using the most sophisticated methods that we can to try to make the most of those available data. But we rarely have data on the underlying mechanisms or mediating behaviors and conditions that lead from a law change to an actual reduction in mortality. What we've done in some of our studies is try to use crime gun trace data to give us some sense for laws that are designed to keep guns from moving from a legal context to underground markets. And to see whether, again, that those map with the gun violence indicators. And in many of our studies, particularly with permit to purchase, we do indeed find that. Another study that Cass Krufasi led, that we were part of, we surveyed people on parole and probation in Baltimore City to get a good sense of the underground market. And this was a couple of years after a purchase permit law went into place in Maryland, along with some other restrictions. And we simply asked them, you know, how did that passage of that law, anything change? Did it make it harder for you to get a gun? And 40% said, yeah, it did. So we were able to use crime gun trace data, survey data to understand the underlying mediating mechanisms, and gives a little more plausibility to when we see any kind of sort of connections in our mortality outcomes, that here's the mediating process for our effects. So I think it would be useful for us to look to gun theft data, particularly when we're now thinking of we have a completely different landscape than a decade or two when it comes to regulating civilian concealed carry. Now, while that principally applies to adults in terms of who can get a permit or not, it could be incredibly relevant to teen access, principally because of theft. In some of the cities where the restrictions were reduced for civilian legal carrying, you saw tremendous increases in thefts of guns from cars. People get in a habit of driving around, going place to place with their guns, and sometimes they'll leave them in their cars. And teens and others have figured this out. So this is something that we might want to connect as well as measuring some of the gun storage practices. And I'll just end just highlighting the data from Cass's. I hope most of you saw her poster, some early findings that we have, looking specifically at state-specific gun laws and their impacts on youth under age 18 and then 18 to 20. Again, we're seeing pretty large effects, protective effects of purchaser licensing, and again, I think that is a function of reduced exposure, fewer guns around for youth to access. Comprehensive background checks, we're not seeing reductions yet. It's a longer story. Some of this measurement issue, when we got down to the weeds, a couple of cities' trends influence these a great deal. So it's a more complicated story. But you are seeing, at least in these preliminary estimates, that shall issue laws with no discretion, making it very easy to get a permit, as well as permitless carry. Our early estimates show that this is indeed increasing youth victimization for homicide. So I'm going to end it on that, and hopefully we'll have some discussion about it.
And Lynn is not here to switch the slides. And now, last but not least, is Ms. Adelyn Allchin, who is the Senior Director for Public Health and Policy at the Educational Fund to Stop Gun Violence.
Thank you all so much. I'm very pleased to be here. Again, my name is Adelyn Allchin, and I'm the Senior Director of Public Health and Policy at the Educational Fund to Stop Gun Violence. I'm going to make my remarks brief. I've seemed to have caught a cold on my way out here, but again, I'm really pleased to have the opportunity to talk to you all. And I think kind of pulling together what we've heard today, and something I want to leave you all with, is that your research matters. Our organization is going to hit the ground running tomorrow with your new findings, the papers you have coming out, and bring that to policymakers. For those of you who aren't familiar with the Educational Fund to Stop Gun Violence, we're a nonprofit located in Washington, D.C. that seeks to make gun violence rare and abnormal. And the way we do that is we work with researchers like the folks here on this panel and in this room, to develop evidence-based policy recommendations, work with legislators at the state and federal level to implement them, and then to work and evaluate those and kind of create the circular process where we have research on both the front end and the back end. So I wanted to just highlight and make sure that you've had a chance to talk to my colleague Vika Chaplin. She's our Director of Research Translation and actually takes a lot of the research that you all do and turn it into policy. And again, today I want to talk a little bit about ERPO, and that's the Extreme Risk Protection Order. And I just want to elaborate on what April said. The Extreme Risk Protection Order is a civil court order that allows law enforcement and family members, and in some states, other individuals, to petition a court to temporarily remove firearms from individuals at risk of suicide or committing interpersonal violence. When this policy was first developed after the shooting at Sandy Hook, the Consortium for Risk-Based Firearm Policy examined the intersection of mental illness and gun violence and wanted to develop a solution that looked at behavioral risk factors for violence rather than mental illness. And again, what they found was that there were clear, bright indicators of risk factors that you could use in a hearing that were not going to stigmatize individuals living with mental illness. And as we've seen in what April's research has shown, and hopefully you've had a chance to see Dr. Shannon Frateroli's poster here as well, and with Dr. Garen Winnemute's research, ERPOs are being used on minors. And so it's really interesting to see this data come in and see how it's being used. And my role is on implementation. So I'm working with stakeholders in different states to kind of see how these laws are being implemented and what they look like. And Washington is a really unique example of a way that they've adjusted their law to reflect the way the law is actually being used. And so what they did was explicitly allow ERPOs to be sought on minors. They made it so that if you had an ERPO, it could be seen in a juvenile court. They also had an opportunity for that individual to petition the court to seal those records. So there are a lot of interesting kind of feedback we're getting as we're learning how ERPOs are being used and how they're being evaluated. And also working in implementation, I just want to talk about the importance of talking to people on the ground and making sure that as you're doing policy research, it's so critical to talk to individuals at that ground level and make sure you understand how that policy is working, how it varies. If you're trying to assess how different states compare, you might want to understand what's going on in that state before you compare it to another state, because you could be comparing one city to an entire state. And so making sure you understand what's going on the ground, start reaching out to folks there, that's really critical. And they'll also give you great research questions. They're always coming to us with questions, and we come to the researchers and have this nice collaboration. The other thing I want to note is that it's hugely important to collaborate with lawyers if you're going to be doing any type of policy or legal research. We have some lawyers on our team. They do an excellent job understanding kind of what's written in the policy and some of those small nuances. So that could be a key area for collaboration. And finally, I just want to say I'm so pleased to be here. I do a lot of work related to firearm dispossession and evaluation. If anyone has any questions, please feel free to reach out, and I'd be happy to talk to you. Thank you.
All right, moving into the question portion. Does research suggest that ERPOs actually reduce suicide and interpersonal violence?
Okay. Yes, There have been a few studies, mostly of Connecticut and Indiana's risk warrant laws, which have been in place for quite a long time. Connecticut's, I think, was put in place in 1998, Indiana's early 2000s. And they do suggest that some suicides are averted due to ERPOs, due to these risk warrant laws. In fact, the much shared statistic is that for every 10 to 20 firearms removed, one suicide is averted. Has there been interpersonal violence studies?
My knowledge is that the only data that we have thus far on the effects of ERPO or ERPO-like laws, technically Connecticut and Indiana are a little different from what we're talking about now, ERPOs. But right now, the only outcome that we have in terms of mortality is suicide. And when you look at the orders, the modal reason for those are people threatening self-harm.
Great. And could you talk about a case in which an ERPO was sought against a minor?
So a great resource for this is Dr. Garen Winnemute's new study that looks at cases where potential mass shootings were averted. And there are a series of examples. Also, if you're here today, you can talk to either April or Dr. Shannon Frateroli a little bit more about what they found.
So in Oregon, we didn't see any cases in which they were used against minors. We're also looking at Florida. To my knowledge, there's been, we haven't finished looking at the data, but we have one so far in which an ERPO was used against a minor, and I haven't looked at the details of that case yet.
Great. How do we know whether cap laws passed 25 to 30 years ago are working today?
We don't. Well, yeah, truly we don't. I mean, I think we need some rigorous research looking at these mediating factors. I know that there are some cross-sectional studies that is covered in your review there. But it's very difficult, and again, we're sort of at the mercy of when legislators decide to pass these laws, and so I don't know.
Yeah, I mean, we don't know, and I frankly am more interested in that first step, at this point than the outcome. I would really like to know if these laws affect safe storage, to begin with, because if they don't, then we wouldn't really expect to see, that the outcomes we're hoping for. But if we do, then we can have some good hypotheses that drive those research questions. But we need the variation to model.
The data are a little mixed. I mean, there are some cross-sectional studies, slightly different data used, and they don't all come to the same conclusion. There's not a consistency on that. So still think that there's more to learn about that.
Great, thank you. Can you say a little bit more about why purchaser licensing laws are so much more effective than comprehensive background checks?
That's a great question. It's something that my team, Cass Grafossi, Alex McCord, and I are thinking a lot about. There's a lot to unpack. So I think one thing to note, I sort of focused on process, and that it's a much more rigorous process to get a license than to simply show up in a gun shop and say, I'll take one of those and two of these. So comprehensive background checks are necessary. We really can't have a functioning system to keep guns from dangerous people without comprehensive background checks. But if the way that they have been implemented is that they require, in essence, the people doing the transaction to go to a licensed dealer to to do the background check. We don't know much about compliance. There's a little bit of evidence that there's some compliance, but I think not near what we would hope for. But the purchaser licensing also, many of them use fingerprints for identifying prohibiting conditions, prior offenses that tend to be better than someone just filling out an application and saying, writing your name and some identifying information and hoping they find you in the records. It's far from a foolproof system. And the people, if you sort of think about the mechanics of this too, is the person facilitating that whole background check process in a comprehensive background check regime, if you will, without licensing, is someone who's behind the counter of a gun shop. I mean, it's not a public safety official. Their job is not to, keep us safe from gun violence. Their job is to sell guns. And, I'm not saying anything against them. They're fine individuals. But I think it's a very different process when you just sort of think about, So I think last thing I'll note that I do think is important, and Garen went to me and has just published a wonderful article in Health Affairs on this that really gets into the weeds of all the systems that need to be in place to have a best functioning background check system. Places with licensing tend to have far better records. They use the state-based systems and not just send to the FBI, and the FBI doesn't have nearly as many records as the state. They take longer to do it, so they give themselves a long time to make sure that they're really not missing things. And we know when there's, you only have 72 hours, that's not much time. So there's a bunch of different ways in which a licensing process is just far more rigorous to do what ultimately the fundamental thing is: keep guns from people who are not legal to have them. That includes underage youth, but there's a whole pipeline here, right? Youth are, as I said, they're getting guns through theft, but they're also getting them through underground market channels.
So I really like your comment about mediators and that you were diving down beyond just the ones and zeros. And I think in answer to a couple of these questions, there's either, for much of the studies, it's either the law is on or the law is off in certain years. And it's not as binary as that. And I think there's an opportunity for us to perhaps, as scientists and as citizens, to not simply be at the mercy of the policymakers and what they are putting out there. Perhaps there's more nuance to the ones and zeros, and perhaps we as scientists and citizens might be suggesting tweaks to these laws that we might test anew in the future. Certain adjustments to the laws, and perhaps even, I know we have, and your group has made recommendations to policymakers about what to put in state houses. And I think perhaps we should be going down that road a little bit more, rather than just waiting for policymakers to put something in place, waiting for enough of a post-period to study it, and then making a comment about it.
It's great that this group has Greg Dorfman as, connected to it as a prosecutor. Ultimately, gun policy, in my view anyway, has much to do with accountability processes. And does the law create some accountability, whether it's a parent to secure their gun in a safe manner so their teenager or child doesn't get it, or accountability from anybody who's transferring a gun. And so if they violate the law, that the law is actually strong enough to have a consequence to that. And I think so, yeah, we have to get into the weeds here and look at the whole accountability. How well does the law actually hold people accountable for doing dangerous things that lead to gun violence?
Great. I think that's all the questions for now.